Look hot.
My nipples probably gonna show.
Good.
Hey, what's up, everybody? This is the Unconventional Therapist Guide to Nothing. My name is Dave. I'm joined with my co-host Greg, and today we are recording on a special day. And
Mm.
Greg, in front of everyone, just to look good, I want to say Happy Father's Day to you.
Oh, thanks, Dave. And you do look good. We were just mentioning that. I mean, if there's no other reason to go to the Patreon, is Dave's wearing a very revealing shirt.
Oh, jeez, I
And
now I feel completely
come on
naked out
over, you
here.
know?
Wow.
Come on over for the show.
Oh, I should cover
Stay for
up.
maybe, the mental health chat.
My oh my.
So thanks, Dave. No, I actually Father's Day is an important day, and it's coupled with June being Men's Mental Health Month, which is another important thing. We talked about that last year, but just like most things, we kind of um, maybe forgot about that this year in a sense, unless we're gonna try to pair this with men, which
It
in a way
it
you kind of could
Yeah, yeah.
this episode.
I actually, as you were starting to say it, I was going to say, no, we could just say this was the Father's Day episode because I
Yeah.
think this is something that's probably strongly correlated with men versus women, but obviously could be both.
Yeah, in a way, I was almost like, and there's no truth to this. This is just my own thought. I was thinking that potentially this could be viewed as like male borderline.
Ooh, this is the
Because
male version of borderline. Yeah.
yeah, like
Yeah, the comorbidity is sometimes there anyway, but yeah, this is like a version of what happens in
right,
borderline
like it does
relationships.
seem like, well, we're talking about intermittent explosive disorder, but it does in a way seem like a personality disorder in some ways, doesn't it?
Yeah.
But I don't think
Before
it's meant to be that way.
Also, before we get into the topic too much,
Okay.
just speaking about mental health in general, and like, we had May is, mental health awareness month, and June is men's mental health awareness month.
Hmm.
But
And Pride Month.
and Pride month, and Juneteenth is in June. So there's a ton of stuff obviously going on.
Mhm.
We just had a Friday the 13th. So I went and looked at like one of our old episodes to get a little video clip for social media. And then I went back to that. What was it? The mental health representations in modern monsters or
Mhm.
modern horror monsters or whatever. That was fun. I
That
was
was
watching
fun.
that. I was like, man, that is me like just loving every second of a conversation. I
Geeking out,
enjoyed that.
like we used to say back in the
Yeah,
day, right?
geeking, bro. I was
You could geek out on that one, that's for sure. And you can even go with like, so for me, the creepier of, if we're mentioning Friday the 13th ones, are like the Bathory, the Blood Countess and the Tansler. I don't know if you remember Carl Tansler episode,
Greg,
like
of course. You and
Immurement.
you do mention the Tansler episode very frequently.
I love it. I don't know why. I do love it. Yeah. Well, anyways, if you're interested in that and it is dark, go take a walk down that road. So like maybe we'll shift into a different, is it okay if I kind of dive into
Sure.
this a little bit, Dave?
Sure.
I want to like to start this episode with,
That was a just so everyone's aware, that was a plug to go back and listen to that
yeah,
episode.
go
But that
back.
was a super good episode.
There's a lot of super good episodes. You could do worse. That's what we're trying to
You
say,
could listen to the full one of this episode. That'll
which we
be
don't know yet. This
significantly worse than those episodes.
time will tell. You never know. So Gandhi, you ever heard of him?
Yeah. I
Yeah,
think
important guy.
yeah, I think he's a big deal.
Yeah, he was a big deal. And he said that, and I like this, anger is like electricity. It's just as useful and powerful if used intelligently. And I wanted to preface this
Ooh.
episode because it's like we're going to talk a lot about anger here. But I think that anger has like a really negative connotation, and that's, for good reason a lot of the times. But it's also kind of a neutral emotion. And we'll get to that. So when it gets in the way of like our values or our lives, it's considered a disorder. And you know what kind of disorder, that's what we're going to be talking about today. So it's hard to call having an extreme natural emotion a disorder sometimes, but like the more you think about it, it's like that's extremes are dangerous, right? And I think that like anger, and is Dave, is this like, would you consider this an anger disorder? Or is this like
Yes,
an impulsivity
both.
thing?
It's
Yeah.
both. It's
Yeah,
both because the anger, everybody gets angry, and there's other disorders that involve frequent anger, but
mhm.
it's the issue from my understanding of it and kind of from, just doing the research on it, the issue is more about the impulsivity of the anger
Yeah.
and that inability to kind of like foresee that the anger is coming.
It's so funny that you say that because I think that's kind of how I put it together in my mind. And I
Mm-hmm.
say that a lot because I was listening to a couple episodes this week and I say it's funny that you say that a lot.
That's like your tagline.
That's my thing. Um, but you saying, I don't know, you're almost talking about a lack of insight being a component of this. And what's interesting about that is, so whether it's anxiety, depression, anger, or any other really strong emotions, it's like the impulsivity is that it changes our behavior to do something outside of our values because of a fear or because of a strong emotion instead of having the insight or the pause or something. There's something missing. And maybe it is just insight.
And oh
Like we
well,
forget ourselves. We forget ourselves is I think a huge part of it.
sort of no though, because
Okay.
no, and then the only reason why I say that is not to disagree, but actually to kind of frame it a little differently. Imagine this.
Hmm.
So you go from like 0 to 1,000, not even 100. You go past 100 and go straight to 1,000, right?
Yeah.
Even if you have insight, it doesn't necessarily mean you will be able to prevent this from happening because it happens sometimes without any warning. And like I would, because like I think about kids that I work with, and sometimes when they go from being fine to, I think that I work with a lot of kids that actually have something along the lines of this or some kind of you know adjacent disorder, and I don't know that they even have the ability to say, even if they have the insight, they know what happens. I don't know that they can stop it. Like
All
because
right.
there's
I'm gonna say this as a joke, but I
yeah
also mean it. It's funny that you say that because
okay
you're making me think of, and I'm being honest, times where I've been angry, maybe I'm having a fight with Natasha or probably just Natasha. This is the only time. Well, I think it's when you're significant other when you have these arguments that like, maybe you feel more comfortable being a certain way, whatever. But like, have you ever like angry about something and then like in the middle of the argument, you're like, why am I doing this? Like, why am I so upset right now? Like, why can I just like go walk away? But it's like there's for whatever reason, it's like yeah, you're right. The lack of insight, like having the insight into like this is irrational right now, sometimes isn't enough.
yeah, because
And
it doesn't
sometimes,
stop that it happened in the first place.
yeah, yeah,
Yeah.
yeah. And like I don't know if it's different in relationships where it's like you just want to be like seen or heard or make your point, or there's some underlying thing where like you weren't seen enough, and the intention, and maybe they're part of this is attention seeking, whether that's conscious or subconscious, I don't know. But it also reminds me of when we talked about another great episode was like when we talked about the fall of man, right? Paradise Lost and Camus, The Fall. We kind of talked about beauty and how we you see beauty sometimes and it makes you forget who you are. So that means that like anger could be the same thing. It's just because it has like a negative connotation and beauty may have more of a positive connotation. They both kind of do the same thing. And I think anxiety and depression all do the same kind of thing where they make you forget who you are. And I think in the end we'll see that the treatment for this thing will all be similar to like those other disorders. But anyways, without further ado, Dave, like what the hell are we talking about?
Okay. The topic today is intermittent explosive disorder.
Yeah.
I know you said it earlier, but I was
Yeah.
just making a joke because we did the kind of like only say it once and then not say it ever again. Uh, so into IED,
Hmm.
intermittent explosive disorder involves repeated sudden bouts of impulsive, aggressive, violent behavior or angry verbal outbursts, which involve reactions that are too extreme for the situation. So it's
Hmm.
not just like you get angry and it's something that a normal like a typical person would get angry about. It's like you get angry to the level that most people would never, like you drop a spoon and you're punching
Yeah.
walls or something like
Yeah, and
that,
people are
right?
like looking at you. I think there's like that part of it too, where people are looking at you and being like, "This is over the top." Might be the word, the phrase,
Yeah,
right?
that's the person that everybody looks at and they're like, oh
Like,
boy,
dude, take it easy.
yeah, what's that guy's problem?
Yeah,
I
yeah,
am sorry I said guy. What's
or
that
girl.
person's problem?
Yeah.
What's that guy or girl's problem? That's what they should say. So researchers estimate that approximately 1.4% to 7% of people have IED. And according to the Cleveland Clinic, approximately 80% of the people with IED have another mental health disorder, such as like anxiety disorders, externalizing disorder, intellectual disabilities, autism, bipolar, those being kind of the most common ones.
Yeah.
So not super surprising, I guess, to hear.
No, not at all. Like if you go through those, you're like, okay. Anxiety can sort of act in the same because honestly, if you're like sometimes anger, you can look at it as a secondary emotion, right? Where it's like fear or sadness or anxiety can create anger.
Yeah,
Externalizing disorder, I mean, you've lost me on that one.
right.
But intellectual disabilities, autism, sometimes there is a lack of insight there,
And
right?
there's lack of insight, there's frustrations
Hmm.
with difficulty, whether it's with communication, other,
Social
other
norms.
types of things. But like,
Empathy.
you can just imagine that those mental health conditions allow for more opportunities where a person might get frustrated or angry. So that might be why it feels like, because I wonder if there's some individuals who have this that just don't get diagnosed,
Yeah.
and it's more commonly diagnosed with people with the coexisting because there's more opportunities for them to get
Right.
angry.
Like even saying bipolar, it's like, okay, so if you're in a manic state, that's gonna like manifest in a couple different ways, and one of them can be anger. And is it
Or even
fair?
if you're in the depressive state, because often in
Right.
depression, don't you associate people who are depressed as sometimes being irritable and angry?
Yeah, I do.
Not
Um,
just sad. I mean, that
so,
there
oh,
is the
so
sad part,
interesting.
but
Like anger doesn't have to look explosive like it does in my mind.
yeah,
You know what I mean? Like anger can be like stewing.
it can be irritability,
Yeah.
frustration. Yeah, it could be like just not wanting to be bothered, things like that.
Like an angry old man isn't necessarily like explosive. It could just kind of like be grumpy.
Be a grumpy old man.
That's what I'm gonna be.
All right. So these reoccurring episodes are often distressing, obviously, to the individual, and they can cause issues in various domains of a person's life. Some of those examples are, first of all, probably most importantly, relationships. Others often think that people with IED are always angry. They might engage in like verbal fights or physical abuse at times, and these actions can lead to relationship problems, divorce, or family stress. They can also obviously have problems at work, home, school. That may lead to like job loss, school suspension, car accidents, money problems, trouble with legal issues. Mood disorders such as depression and anxiety, as I already mentioned. Drug and alcohol problems
Sure.
often occur, which I'm assuming would be a way of trying to cope with these huge angry outbursts. So you kind of do that to numb, but I also kind of contribute, I would imagine, and probably exacerbate the issue even more.
Mhm.
Physical health problems such as high blood pressure, diabetes, heart disease, stroke, ulcers, and ongoing pain, and as well as a person with ID may engage in self harm or suicide attempts, which
Okay.
is obviously probably the most serious of all of those. Not that any of those is not serious.
Yeah. So like drugs and alcohol, I can see how it would lower your inhibitions and like it's like gets you closer to that breaking point, right?
But they probably feel like numb
Mhm.
or like they feel like better probably
Yeah. Yeah,
it
like a
for a
break from it.
moment
Yeah, like a
until,
break from
but
it.
you're everyone who's ever been intoxicated knows you get super reactionary and emotional though when
Mhm.
you're under the influence. Isn't
Yeah.
it interesting that we do use drugs and alcohol to like numb feelings, but we become actually more emotional while using it?
It's I think alcohol is the most insidious of all. And that doesn't mean that I don't have a drink every now and then again. I know, or you, right, like a beer or whatever.
Yeah.
But man, it's like it does all those things. Like if you're nervous, it'll calm you down. If you're shy, it'll break you out of your shell. If you're sad, it'll make you feel a little better. If you're if you're super happy, it'll make you happier. I don't know. It's like it's one of those, but then like in the end, it does all come crashing. It almost has the opposite effect with
Absolutely.
withdrawing, you
Like
know?
the worst thing that can ever happen to me is there's some kind of conflict that leads to an argument while I've had a few drinks of alcohol
Mm.
because I just feel so like 10 times more emotional and I have way less ability to manage my emotions.
Mhm.
I just have no just like tolerance, and it just feels way more intense.
It's
So
scary.
imagine being someone with IED and suddenly a situation happens that's going to cause you an angry outburst. It probably feels like you're exploding inside.
Yeah, like Tasmanian devil. That's what I think of, like as like a
Oh, that's a
yeah,
that's a decent visual right there.
yeah, right. And it's
Jeez.
I don't know how. Well, right.
I
That's
guess I was thinking more like Hulk.
Hulk for sure. Yeah, Hulk for sure. That's even like you think of like
I think a
bipolarness.
Tasmanian devil with like ADHD.
That's true too.
Because just like
Well,
scattered, you're a mess. You everywhere you go, you're just causing dirtiness and
yeah, and is he
dust
angry?
clouds.
I don't think so.
I don't know if
I don't think he's
he
really
just he
angry.
just it's hard to understand him. He's like,
Yeah,
what are
yeah.
you saying?
Yeah, and you know what? Half our demographic is like, what the hell are they talking about?
What
And they
is
would they
the
would know even less about what we're talking about if I was talking about I had a t-shirt with a Tasmanian devil with like a backwards hat and like a chain.
Bugs Bunny and the Tasmanian Devil looking like b-boys with
That's
backward
right.
hats and baggy
Exactly. That
clothes?
was good
Oh,
stuff.
just as crisscross. That's what it is, right?
Yeah,
Oh my
yeah.
goodness, we just
Good old
lost
days.
everybody.
Yep. Yeah. Not everybody. That's for somebody.
Somebody knows what we're talking about.
Hmm.
Um, all right, so this condition can last for long durations of time, but symptoms of or intensity may decrease with age. So as you get older, you may notice some decreased episodes of intensity, but I mean, I'm sure people can have this their whole lifetime, I would
Yeah.
assume. Um, to receive an IED diagnosis, you must display a failure to control aggressive impulses as defined by either of the following. So there's two criteria here: high frequency, low intensity episodes. So that would be like verbal aggression, such as temper tantrums, verbal arguments or fights, or physical aggression towards property, animals, or people occurring twice weekly on average for 3 months. And the aggression doesn't result in physical harm to people or animals or the destruction of property. The other criteria would be low frequency but high intensity episodes. So that's 3 episodes involving damage or destruction of property and or physical assault involving physical injury against animals or other people occurring with a 12-month period. So that's only 3 episodes in a 12-month period. Actually sounds kind of low.
Well, when you start to think of like when you see how
How
these sort
intense?
of manifest, yeah, it's kind
Sure.
of wild. Just like bipolar surprised me too when you first started learning about
Yeah.
that way back in the
Yeah.
day, where it was like you have like maybe one or two manic episodes a year. Some people, and some people obviously it varies person to person, but like that is one is enough for a bipolar diagnosis.
I'm
One, I
not going
think.
to lie, though. This does seem like that low frequency, high intensity version of it probably seems really hard to diagnose or catch. Because I
Or
mean, at
maybe
12
shouldn't.
months, they could be spread out so far.
eh,
Who knows if you would even attribute the previous one to it.
And I almost feel like a diagnosis would almost validate, in some cases, someone who just needs to kind of better manage their behavior.
Sure.
You know what I mean?
Yeah.
Where like, and I don't want to be insensitive, but it's like we talked about in that episode of concept creep, where it's like sometimes you create disorders where disorders don't need to be, and people just need to, sort of you need to be better, man or lady,
Yeah.
right?
Yeah.
So there's an element of that because these outbursts, this is what it looks like. They can occur out of nowhere. Feel like there's no warning, which might be scary to the genuine, sufferers, and they can last for 30 minutes. Now, Dave, does that seem like a long time to you?
Yes.
Okay,
It
good.
seems like a very long time because I was actually like trying to put myself in the shoes of someone with this, and I'm like, I couldn't even think of a time where I've been angry for more than like several minutes.
Yeah,
I'm
so
not. I don't get angry very frequently. It takes me quite a bit to actually like feel like I've crossed the threshold into full blown anger. But
yeah,
like honestly, for even like a 5 minute burst of anger for me, I it feels like a eternity.
yeah. So you're like the Dalai Lama. I can think that maybe
Like
30 minutes.
full anger though,
No, 30 minutes is incredible. Do you think of the amount of damage you can do in 30 minutes? I mean, to relationships and people and
because we're talking about one of those two criteria. We're either talking about
yeah,
like it's happening frequently, but like low intensity, or it's happening in a high intensity for 30 minutes.
yeah. Yeah, like if you watch someone, like if you're like on a lunch break or something that's like a half hour, they're like, he's been mad the whole time. That's a long time.
It's like,
You've
what is
been
he even
yelling,
saying? Like after a little
screaming.
while, he's just like, "Ah," like
It's wild.
what?
Yeah,
And it's about like sometimes like it's out of proportion to whatever the situation is too. That's the other part of it.
out of proportion and sometimes out of nowhere, which makes it difficult for the person experiencing it and the people around them too.
Yeah. So I
So
mean, just to clarify though, 30 minutes is like the max of what an episode would look like. It's typically less than, but we're just kind of highlighting how crazy it would be to even have it last for 30 minutes.
yeah, and in between these outbursts, there's like smaller verbal attacks or physical attacks. So like even when you're done with it, you're not really done with it. It's like you're it's almost like having a panic attack, and your body can only have a panic attack for so long, and then it's gonna kind of wear out. But with these condition, like the anger is not gone. So it's like you have like a little couple bursts here and there of like last breaths of anger. The anger is not gone. So living with like this level of anger or intensity is got to be pretty
Yeah.
pretty tough. And they may present as irritable, impulsive, aggressive, or angry most of the time. So can you imagine? I mean, if you're being honest, like this isn't someone that you're gonna want to be around. And so then there's gonna be isolation.
Which is why someone would probably eventually like those problem domains we talked about in the beginning. Those are the reasons someone's going to get a diagnosis. Like they're going
Yeah,
to pursue treatment because of the aftermath, not
right.
because of the episodes themselves. I'm sure,
No,
like
because you're probably gonna
as
feel validated in it in some ways, right?
right, right,
And
which I'm sure
it,
we'll talk about a little bit later. But yeah, you're right.
so it just almost like the reason why when we talk about bipolar, and it's fun, it's strange this keeps coming up, but it's like you don't see people when they're manic, you see them when they're depressed. So
Yeah,
you don't see people when they're angry, you see people when like their life has kind of fallen
yeah.
apart, like they've lost their
It,
employment and friends and family and
I often talk about that too because like I think people lose sight of that. Like when we experience different things, that's not typically when we go get the treatment
yeah.
for the or go get the help. It's the things that have happened as a result to those emotional experiences that we're having. Those are the things that people get treatment for. When you
Hmm.
lost your job or you're getting a divorce because of whatever you're going through, that's the thing that actually brings you to treatment usually.
Yeah, or like someone making it conditional, like a family member or like
Yeah, you
almost like
have to do it. Yeah.
yeah, like a what do they call it? It's like an intervention.
Ultimatum
Yeah, ultimate. Yeah.
or an intervention. Yeah, either one.
It's an anger intervention. Um, so symptoms or signs are going to be, obviously rage and irritability, more tension and energy. So it's almost
So
like
these are what you would experience before the
right,
outbursts.
right. Racing thoughts, tingling, shaking. So a lot of these sound almost anxiety, faster pounding heartbeat, chest tightness. So it's like you're almost like kinetic at this point. I feel like when this is being described, it's like I think of someone who's like almost vibrating. You know what I mean? With they're like, "Arr!" It's sometimes I'm so angry,
Yeah,
and just like I don't
but
even
it's
know
happening
why.
quick. It's
Right.
like it's quick because that's part of the problem. Like we were saying earlier, it's these things they might experience that before, but they're happening so fast that sometimes it's hard for the person to even like get a hold of themselves or intervene at this point.
Yes. So temper tantrums, these are some of the outbursts, what it might look like, what it might include. Temper tantrums, which is an interesting thing. Like, do adults have temper
Yeah,
tantrums?
yeah. And you know
Okay.
what's so funny? I feel like forever I was like nervous to use the term temper tantrums.
Hmm.
But working with kids or working with people with disabilities, I find myself having to sometimes find descriptors for what
Yeah.
at my other job I write behavior plans, so I have to write what the target behaviors are, quote unquote, and that's like the whatever we're trying to correct or work on. And temper tantrums is something that I find myself having to use, and it felt weird the first few times I was putting it in paper, but like stomping feet,
Yeah, yeah,
jumping
yeah.
up and down, pounding on walls. I mean, those are temper tantrum behaviors that can be displayed by adults.
Also, long, angry speeches. Um,
Was
it's
that a
almost
me?
yeah, no, I know, right? No, honestly,
Wow.
it's funny that you say that because, like, you know what I mean. If someone, I've been known for a long speech. I don't know how angry, but like, if you're trying to get your point across, but that's the thing too. Like, we're all. in relationships, we all have like we're all human, so we've all had pieces of this for sure. So when you're in a heated argument or something like that, shouting, slapping, shoving, or pushing is something that's in like physical fights and damaging property. Now, this is harming people or animals. I mean, I know Dave, especially when you throw that A word in there, you get a little. You might be having a little ID yourself over there. I
My
see it.
my arms are flexing right now. I'm getting so
I'm
pissed. I'm getting so
tense.
pissed off.
All right, so we got to start working on maybe some coping strategies for that,
Some muscle relaxation.
awareness. Maybe see this t-shirt, I got a Grateful Dead t-shirt on. Maybe throw that on. That'll calm you right
That just
down
gets me
too.
more angry.
Oh
I'm
no.
like through the roof right
Will this
now.
song ever end?
I'm through the roof right now.
So the real problem, all seriousness, comes in the aftermath of these episodes because, you know, you can say it might provide some relief or exhaustion. Now, that's gonna that's what's interesting, right? So that first part, and then, now obviously there's gonna be some like emotions like guilt or embarrassment, of course, but the first part, there might be some relief or exhaustion, and relief being the key word there. So it's like your brain might be saying, "Oh, this is exactly what I need. This is relief from those things we were talking about a minute ago, those like early symptoms. So like racing thoughts and irritability and rage and tension. You get relief from that through expelling all this." Which makes your brain say, okay, so we get a little dopamine here. This feels good. We're finally in a state where we can deal with this for a little bit. How do we get here? Okay, now we're kind of in this cycle again. That's what worries me about like when you're dealing with like an episode like it's almost like when you're treating ADHD or something like that, you're trying to treat like procrastination or impulsivity, and this is the same thing here. We're like trying to treat impulsivity is difficult because the nature of impulsivity is it's hard to fucking get a hold of, right? So it's like I lose control. Well, like stop losing control. That's the key. Well, it's like okay, that's easier said than done. Like what can we do about that? And I think there's a lot to be said for like values-based action and like mindfulness and exercise and all these things that can help. But really, you can see how this is a difficult thing to treat because like I blow my top. I lose control. I'm impulsive. And maybe we're talking about maybe thinking about a similar person here that's going through a difficult time who's impulsive and maybe makes these rash decisions, and then with some distance from the he's like, oh well, like I noticed that like a lot is going wrong in my life. If I could just get a hold of that impulsivity, it's like, all right, well, what's going to be the big enough reason, or what's it going to take for us to kind of pause that or check
So
that? You know
yeah,
what I'm saying?
and it's interesting because one of the advantages that adults can have over, let's say, a child that's dealing with this is adults do tend to have some more insight, right? And
Mhm.
they tend to have a little bit more ability to actually use that insight to understand, like, I can get a hold of this or I can catch this before it turns into that thing. Even though I know it kind of contradicts what I was saying earlier about how quickly this goes. But like even if I notice one of those early warning signs that
Mhm.
we talked about, the racing thoughts, the tingling, the shaking, the fast, even if I notice one thing is happening, I can start to take steps to work on calm
Mhm.
instead of allowing myself to continue in the wrong direction. And like because of the work I do with making behavior plans, that's like ingrained in me is
Mhm.
looking what are your early warning signs. And I'm in that world where I'm constantly working with kids or people with disabilities who sometimes lack that insight themselves. So I'm kind of accustomed to teaching people to how to like get people to prompt those skills when they see those, like, so I'm externally looking for them in other people, but if I were someone with it myself, I have to start to pay attention to how I'm feeling. And as soon as I notice those things, it's like, all right, I don't care if me and you are having an argument right now, I got to go take space. i
And
need
and
a i
that
need a safety plan,
the
right?
ability to do that creates some kind of agency. It's like, okay, so I do have some power over
Right.
this. And then you start
Right.
to build confidence.
And
And then once you build confidence, it kind of you're in a better spot. You can, and also there's an element of future orientation too, where you're like, all right, like so once you start building confidence, you start
yeah,
building a better life, and then you have more to lose, and then you can start thinking of like, well, what happens if I lose my like, control again? And
yeah,
then you can start to work through it that way. But I think you're right. It is about noticing that
early warning.
tingle, that
Yep. Yep.
first thing. It should be that's your body's warning you something.
what you said in that first statement is exactly it. It's so this is something that I feel like leaves people feeling like they have zero control over themselves.
Hmm.
But what we're suggesting is there is some signal that happens at some point that does tell you that it's about to happen, even if it feels like it's happening in like literally a blink of an eye. There is something that happens before it happens that you
Hmm.
can start to learn how to identify, that can hopefully tell you I need to chill out, because if I don't, this is like, this and this is probably going to happen. But
Hmm.
you do need to also be able to think that future minded, like you have to understand this is like these are the bad things that will happen if I don't get a hold of this. That's typically where kids struggle, because
Yeah.
they don't care about all that stuff.
Right.
They
Right.
want the relief. They like, that person pissed me off, I want to make them, I want to hit them right now, right?
Mhm.
That's a kid's mindset. Typically it's like the hardest thing to tell a kid, like don't hit a kid, don't hit someone back.
Yeah,
Like
because yeah, and like there's
they're
like a
like,
fake
no, I
malice.
want to.
Yeah. No, I want to. It's great. I'll
Right.
feel good. And it's like, okay.
Right. But then you get in trouble and they typically don't care as much. So causes, onset. Well, this could be noticed from 6 years old on, specific, like, especially in like teen years, I would say. And it's probably more common in younger adults than older adults. However, could be present in either. Some factors that may impact this. The first would be like living environment. So a lot of people with this condition grew up in, situations with family members that were like explosive behavior, and verbal and physical abuse were common. The child As a child, they might have seen, um, or gone through violence and other types of things like that. So it's definitely can be impacted by the environment that you grow up in.
Hmm.
Genetics can play a role. There could be a gene related to the tendency to react more easily to stress. It also makes me wonder if like culture can be an impactor there, like both with living environment and genetics. Like Italians are known for like fiery tempers, or like
Absolutely. Like it's funny when they say living environment and genetics, and it's like what like
it's
because it's hard
cultural,
to, yeah, it's
right?
hard to differentiate between those. It's like
Sure. Like yeah, and there's like some cultures are known to be more like loud and
Mhm.
fiery, and then there's other cultures that are just very calm or quiet. And it would be interesting to know in those homes what is like the percentage of IED in those types of communities. I would
Yeah.
love to know that. There's a
Right.
research
Or
right there.
like, because it's like some cultures might value anger. It's just like we'll talk about like sort of the ancient world just for a little bit at the end, and there's kind of some reference to that where it's some think it's good, some think it's bad,
Yeah.
right?
Yeah, some different cultures that like kind of almost brag about
Mhm.
their how
Yeah,
like
very.
volatile
Yeah,
they
yeah,
can
yeah.
get.
Yeah, they're like
Um,
after one of those like 30-minute they might be like that was pretty good, huh?
what'd you
Pretty
think?
good.
It's just how we talk.
That's
Yeah.
how we are.
Yeah. Differences in how the brain works. So there may be differences in the structure, function, and chemistry of the brain with people with intermittent explosive disorder compared to those of people who don't have the disorder. The one thing that strikes me right away is, well, first of all, like those areas of the brain that kind of like can process information and weigh pros and cons, like obviously that's working at a
I like to call that
significantly reduced rate.
the front part.
The frontal lobe, right?
Yeah.
Is it the frontal cortex? I can't remember off the top of my
Prefrontal
head.
cortex,
Prefrontal
prefrontal
cortex.
area, however you want to look at it, like the analytical part of our brain.
Yeah, there's
The
no
front.
rationalizing happening,
Yeah.
right? And so obviously that's working at a significantly reduced rate. But is that just because they're angry, or is that just how their brain's working all the time? I don't know.
Like they're
Um,
spending more time in their like sort of more primitive parts of their brain. You're saying
yeah,
like the limbic system,
the
perhaps. Like
amygdala is constantly firing. It
yeah,
feels
yeah,
like,
yeah.
the smoke detector.
I got that amygdala going.
You like chill your amygdala, bro.
Yeah. Yeah, dude. I
Uh,
actually have a deck of cards that like is like all different little like ways to calm your amygdala if anybody's interested.
Wait, have you ever done like taught someone about the brain and like done like the hand, and then you like lift up your fingers to show them where the amygdala would be?
No, I don't. Why is that useful?
I don't know. I just feel like
That sounds
that's
like
something you would
a
do.
sounds like a kind of a never mind. Dirty little game.
Feels like something you would do.
Yeah.
Here's the people, and
And
here's
then
the
yeah,
steeple, and
here
here's all the people.
that's right. I remember that one too. That's an old reference.
It is.
Anyways, we should probably get back on track.
All right. So other factors: history of physical abuse. So being, abused as a child, bullied, going through disturbing or shocking or painful events. History of other mental health conditions, as we mentioned. Antisocial personality disorder and
Mhm.
borderline get brought up here. Let's see what else.
Yeah, but you know what they say? Just a quick mention on the antisocial or borderline, which might surprise people, is that the explosive nature of this, it's is said to be like they don't. It's kind of a separate disorder because it's much worse than even that of antisocial or
Hmm.
borderline, like the explosive nature of it. So it's like, whoa, like if the borderline and the antisocial is like in the room, they're like, all right, dude, take it down a notch. You know what I mean? So
Yeah.
it's like it's heavy. It's heavy.
I like the thought that you said earlier though about is this like the male version of borderline? Because like we said, this destroys relationships,
It
right?
does.
Nobody wants to be around this person. The only thing that's probably different is the intentionality. It's not like you're not doing these behaviors with the intention to be pushing and pulling in the relationships. You're doing them just because they're happening, because they're impulsive as hell
Mm,
and you have no emotional regulation, right? With
yes.
borderline, it's typically with the intention to either damage or do something to the relationship, correct?
Yes.
So that's the
Yes,
only thing I think that separates it, maybe
but you're also driven even in the borderline. So you're like driven by this
emotion.
like yeah, it's like this need to be seen, to be accepted, to not be abandoned, to be you know. So Dave, I think a good question is to kind of well, let me present this to you because we've talked about
Hey, Greg,
yes.
present away.
Okay, scared me. Um Okay, so there's 300 some mod disorders in the DSM, maybe too many. Is this a legitimate
I think this is a legitimate
it's a hard
one.
word. Is this a legitimate disorder? Or should it be a disorder? Or should it like be a symptom of a different disorder? Like is calling this a disorder sometimes giving people an outlet or an excuse to behave in a, antisocial way?
Greg, I'm
I
so
don't know.
glad you asked me that question.
Okay.
That's the question I wanted to answer this entire
For
podcast
real?
episode.
I
Yeah.
can't even track you right now.
No, it's totally a real
Like,
disorder, I think.
okay.
100% legitimate. And no, I don't even think that it really justifies or uh is like I don't feel like it's something that would be. I'm trying to think of how you worded it. I'm trying to say it back to you. So like the reason why I feel like it's legitimate is
Mhm.
if somebody is having these anger outbursts
Mhm.
and they're looking for an explanation to help them
And
understand
okay.
and manage and find coping skills, this is super helpful for someone to see and get like because what would you attribute this to instead? In a personality disorder, probably.
Sort of, yeah.
Yeah, most
Yeah,
likely.
or like there used to be called see, so that's more of what I'm thinking of. Like it used to be called like anger dysregulation disorder, which I thought was like a pretty accurate representation of it.
Hmm.
Um,
It's all the same to me. I
it's all
mean,
kind of the same, right? And what does stick out to me to give it some validation, and I'm not asking that because I don't think that it is valid or anything. I'm just kind of like this is what we do. We're a podcast. We kind of like get both sides of the story here.
mhm.
And like the outbursts that are more severe, they're seen as being more severe than the cluster B disorders, which are, your antisocial, your borderline, your histrionic, um, those personality disorders. That sticks out to me a little bit. So that makes it a little bit different, right?
Yeah.
Like it's
See,
it's
see, my big thing is again, I come back to like that intentionality or like the reason for the anger. And to me, when I'm hearing the explanation about this doesn't feel like it has the motives that I hear in some of the personality disorders. Like this isn't someone in my from the way it's described.
Mhm.
This isn't someone who's worried about abandonment. It's worried that they're feeling like the person that they're with is, going to leave them, and now they're getting angry because of some like insecurity around that. This is literally someone who
Out of nowhere.
out of nowhere,
Mhm.
I keep coming back to that idea that like they dropped like a utensil or something when they're eating and suddenly they're flipping out and punching walls, or like the smallest thing happens and they're freaking out all over the place. So like it just, for me, it lacks the motive.
So maybe that's why they shift the name from anger dysregulation to intermittent explosive, because it's like if we talk about anger here for a second, it's like it's this neutral emotion that we've mentioned, and it's like this automatic reaction, like you're talking about, but it's a reaction to threats or injustice or
Yeah,
frustration or some kind of violation, right?
sure.
And it's disrespect for me, I think, frustration too. It's a secondary emotion that masks like fear, sadness, or hurt. So that could be there, right? It could be like a reaction, an overreaction to like a violation or a frustration or something, but like that you're not quite conscious of. Like that could be it.
But here's the thing, like if I as I'm thinking about this, I'm like, all those things, it
Yeah.
feel almost inevitable over a period of time for a person not to start to feel and then
Yes.
start to respond to. But at some point, it started somewhere. And I think that's the thing they really need to kind of like
Mhm.
pinpoint when they're looking at like, what is this diagnosis? Is this a legitimate diagnosis, or is this, a product of something else? Is this something that just forms and really is like disconnected to those other disorders that you mentioned?
So
Is it really
started
that
somewhere is
they're,
key there.
yeah,
Almost feeling like almost like a like in some ways. That's why it goes back to that male borderline, because it's like a not that the borderline can't be male. That's not what I'm saying. It's just
no,
that
we understand. It's
yeah.
like we talked about when we did the borderline episode. It's predominantly seen in females. From statistic. Well, was that the case, or did we
Oh
end up
yeah.
finding
Oh
out?
yeah.
That was,
No,
yeah.
yeah.
Now I'm getting confused with
No, it is.
when we did the stats of self harm one.
Right. And but the thing is though, if it starts from somewhere, you might not remember or even know. Like you could have been making decisions and you just start like behaving a certain way because an event happened, but like years down the road, you have no idea why you're behaving the way
Sure,
you're behaving.
one hundred
And
percent.
so it's sort of like a trauma disorder.
And you're building traumas as you go along, because there's no
Yeah.
way that you're having this behavior and all these negative things are happening in your surroundings because of the behavior, and you're not being impacted by those things. So like it does compound on top of itself, and then you see why there's like that comorbidity with so many different disorders and why it's so closely like correlated with certain things. Those, what came first, who knows? But like, yeah, of course, if you're having explosions everywhere and people are responding to that, or you're having, terrible, you know, situations in work or school or wherever, of course, those things are going to like weigh on you over time.
Yeah. And it does say that it's not like we mentioned, it's not far from depression or anxiety to the point where it's like, I don't understand. Sometimes the most difficult part about depression or anxiety is like, I don't know why I'm so either freaked out with anxiety or down with depression. That was what makes it even harder. Like, I don't know why I'm having these behaviors. And then so like it makes sense that if you're saying that with your anger and your explosions, your, whatever you want to call it, right? Like it's like, all right, well, what's going to be the best kind of approach for that? You're still going to be ACT, you're still going to be DBT or CBT, you're still going to want to like pause and breathe and think consequences and take value-based action. And you want to challenge your thoughts and you really kind of, I think with this is going to be like almost be like address your behaviors
Oh
first.
yeah, that's kind of what I was saying when I was
Yeah.
what I was saying earlier. First, for a second, I also want to say I really like that you said that you're down with depression. That was really cool of you to say. You're
Yeah.
down with depression. That's
Yeah.
nice. But like you almost want to make a behavior plan for yourself,
Hmm.
or have someone work with you on a behavior plan.
Behavior modification for
Yeah.
sure.
And because honestly, that's a lot of what this is. And if you can start to learn new responses and new um, ways to work through, situations, it may not eliminate these, but it definitely can show you and build that confidence, like you were saying, and that
Yeah.
autonomy, make you feel like you have a sense of control over yourself. Because I gotta imagine someone with this disorder must feel totally out of control.
Out of control. And that's the scariest thing that as human beings, we're all seeking control and order and safety, and it's all kind of the same kind of feeling. Um, And that's why I think so. Like CBT, you're gonna be working on your thoughts. DBT, you're gonna be like kind of more focused on emotions. ACT is like a values kind of thing, which kind of like supersedes all of it, which I think is super useful. But the thing that connects, like, allows a disordered like this, like anxiety, depression, to thrive is that connection between your thoughts, your emotions, and your behaviors. So maybe with this one, it's more appropriate to address the behaviors so that your thoughts could change and your emotions can change. And I think that's probably would be the best approach.
It's probably some good medications out there too.
There are some good medications. Probably the NSSRIs are going to be one of them, and then whatever else, like
Mushrooms.
mushrooms. Yeah. Yeah, exactly. Anticonvulsants, things like that. So, like a real quick, though, I thought that'd be interesting to mention, like how the ancient people thought about anger, and I can be quick with this. Like, I thought this was important because obviously people have been dealing with this since the beginning of time. So, like, you're not alone. It's always good to know that. Stoics, like Seneca, he didn't like anger. He just like the Stoics in general didn't love emotion, period. So I think like there's a lot of value in that, but there's also they're missing a lot, I think. And they refer to it as like temporary madness that impedes rational thinking and virtue. So that's true about anger, though.
Mm.
Plato was a little different. He thought there was some value in it, but mostly warned about the negative consequences. And again, thinking that like your anger left to its, unchecked it leads to irrational action. But then my favorite always is Aristotle, who, he has this idea of the golden mean, and anger at the right time is good, at the wrong time, not so good. Basically simplifying it like that. It's like we don't have to like lose this part of you. We just have to make it appropriate.
Yeah.
You know what I mean? Like if you were uncontrollably laughing, it's like laughter is not bad, but in the right, it's got to be in the right sort of like frame.
It's like the movie Inside Out, right?
Yeah.
Like everybody has anger.
Hmm.
Everybody experiences anger. There's nothing wrong with anger. It's a valid and appropriate thing to feel at times, but it's what you do with your anger that's the issue. And when your actions during an angry moment go against your values, then that's the thing that's going to make you feel worse. So those are the things that leave you feeling guilt, shame, embarrassment, all those things. So that's why this becomes an issue,
Right.
because they have very little control in the moment. It's so elevated over what they do with their anger.
So it's funny, like shame. Whatever begins in anger ends in shame. That's an old Ben Franklin quote.
Well, that's a banger right there.
It's a banger, right? And that whole there's some value in that. Like the greatest remedy for anger is delay. That's Thomas Jefferson. He would be the one that's like, I do remember him saying, not personally, but the quote being, we did an aphorisms podcast not too long ago, and you can't fit them all in. But Jefferson would say to count to 10, and then he said, if you're really angry, count to 100. There's some like deep wisdom in that, right? Where like distance from it, maybe diffusion, maybe the counting is like diffusion, and like getting some space from it, and just pausing before you react. There's some real value for that. Even with people, like when I'm treating OCD, in myself and others, it's like if you have a compulsion, like the best thing that you can do is delay it. Even if you can delay it a little bit, you've done like good work there.
Yeah,
And
you've shown yourself you can do it, right?
yes, absolutely. So I mean, I think you know I one last thing I'll say, Dave. The movie Anger Management. Remember?
Yeah. Yeah.
I guess that's
That's
I
it.
guess like the Woo-saw thing. Like
Yeah,
I
yeah.
don't remember all of that movie, but I remember, anger management being
Wait,
sort of this
wasn't
thing.
that in Seinfeld?
No, Woo-saw was in
What does
anger
he say in Seinfeld?
Serenity Now.
Serenity Now. That's what it was. Serenity Now.
Yeah, yeah. Yep.
So yeah,
And he like but hysterical because he like screams it angrily.
exactly.
So, I mean, yeah, good stuff.
Yeah,
But even that, right? It's a baby step. Baby steps is what about Bob?
I
So
love What About Bob. That's great.
great stuff.
Yeah.
So I think that's, essentially what we have for this. Dave, do you
Wow,
have anything?
that was
Go ahead.
a better episode than I thought it was going to be.
Like that was going to be a real stinker.
I was worried that it wasn't going to be interesting enough, but as we were talking about it, I was like finding myself feeling very passionate about it.
It's interesting. Anger is a very relatable thing, and it's
Yeah,
almost like taboo.
I just, as I'm talking about this, I keep just going in my head to the people that I work with, but like who maybe, like I said, who have less insight,
Mhm.
but then kind of thinking about the people who might be experiencing this, who have more insight, but feel like they don't. And like, it just can't help but like feel some empathy towards them and like wanting to like help them understand. Like, it just takes really dissecting and analyzing and really looking for those earliest moments to start to work on this. So I just hope that if there is anyone that, struggles with this stuff, they can, if anything that they can take away from this, it's just like there is hope. Don't feel like you have zero
Absolutely.
control.
Always. I
Yeah.
mean, we're from Rhode Island. That's the state, motto. Um, and I have hope. I have hope that our Patreon will grow a little bit.
I
And I
thought it
don't
was
want to,
like warmer, cooler or something was the
no,
state
Dave.
motto.
Cooler and
Remember that?
warmer. Yeah, I
Cooler,
do remember
warmer.
that.
Yeah. When they try to
And
make
the, and
that joke.
the the governor had like a video that she paid like millions of dollars for, and it was like people skateboarding in New Zealand, and we're like, what is going on?
Ooh.
Wasn't even from Rhode Island. Um, but that being said, Dave, how important is it becoming to us to have this community on Patreon?
Oh, it's super important. It's kind of like what we've wanted
Hmm.
for so long. So that's why we keep encouraging people to, come on over and join in on that community and participate. That's going to be the next thing, obviously. But, first just building the community. We're trying to get some prompts up and get people chatting. But we get so many comments from people which are always amazing, and like we're so proud of them, I guess. Like I guess that's a word to use, like pride. I'm always like, sometimes it's disbelief that people actually like even talk to us. Um,
Yeah.
but like also wanting to like connect with others and getting others to connect with each other and just expand on some of these topics feels like, I don't know, that's
And
kind
my
of like
hope,
what
my
we
hope
always
with the
wanted.
Patreon is that people can come and share, and with a community who's kind of like super open-minded about everything. And it's like, maybe you can bring, like, my dream for it is, maybe you're going through something, or you have an issue, or you need some insight about something, and maybe someone's been through it. It's a mental health podcast, after all, right?
Yeah,
And you share something, and then someone's able to share something back that kind of like really provides that insight or that experience or something that you're needing. And it does give you that thing that we're talking about, hope, which is just a beautiful thing. And you get
absolutely.
that through community, I think.
That's where I
So,
always find it
you know, so
within the
let's
community.
hope that people come join us. And we're not making a plea for, to join the paid parts of it. Right now we're pleading that you just join, even for free. And then, down the road maybe we'll plea that.
Yeah,
You
yeah.
know.
Yeah, we just want
So,
people to come on over and kind
yeah.
of, hopefully we can get something going and, make that decision for yourself. But like Greg said, yeah, it's important just to get that community built.
Let's get
So,
those numbers up. Let's get those
yes.
numbers up.
Yep. All right. Well, I think we can leave it there. Good episode. Thanks, Greg.
Good episode. Yep.
This was a recommendation episode too. So I just want to thank the listener or the viewer, depending on where you're listening or watching, for suggesting this. It was actually, I thought it was a good one.
Me too.
One I wouldn't have thought of myself is what I guess what I mean to say. I hadn't thought of this episode. So
I'm glad we did it. It was interesting.
yeah. All right. Okay. Well, with that being said, we will be back next week. And everybody, have yourself a lovely little night, day,
Father's Day.
Father's
Father's Night.
Day, week.
Yeah.
See you next week.
See you next week. Yeah, for
Goodbye,
sure.
everyone. I'll put some clothes on next
No, don't. We need the people.
time. All right, everybody. I'll see you later. Bye.